is conduct your promotion interview from green scrubs to white. I'm going to ask you a few questions, several questions, and then go ahead and just answer them to the best that you can. Okay?
Okay.
Okay, give me one moment. Okay, Adam, I'm going to go ahead and start your interview with some questions. The first question is, what are the main expectations of a green scrub while working in the hospital?
Main expectations is following all the HPMD rules, being respectful to all patients, no matter what faction or organization they're part of, and basically just sitting behind the desk is the only place we can sell pills or medkits.
Great answer. Perfect. All I'll say just and also keep practicing your micros, but you did it. That was perfect. Okay, question number 2. Why is it important for green scrubs to remain supervised?
Just because that's the beginning, so want to make sure we're doing everything correctly so we can move up the ranks and do everything correctly.
Great answer. And then also, you know, use proper doing proper RP, but perfect answer. Okay, question number 3. Who should you contact if you need help during a hospital scene?
I mean, wouldn't it be anybody?
Oh shit. Damn. I'm so sorry. I lost connection. My
No problem.
apologies. Okay. So, the last question, I know you probably answered it. I think you answered it correctly, but it says, my question was, who should you contact if you need help during a hospital scene?
Yeah, this one I wasn't exactly sure, but I said anybody higher up than you, but preferably purple or higher, I believe.
Wait, no, great answer. You actually answered the question correctly. So let's just say, No white coat or higher is here. You can go ahead and go to a white scrub or a blue scrub or higher. Pink, then brown, white coat, then purple dress, purple dress, purple pants, and therefore. So you answered the question correctly.
No, perfect. I actually have a question on that.
Yes.
So let's say it's only green scrubs in the building.
Yes. Then
What would be the...
that's a good question. If there's only green scrubs in the building and there's a chaoticness happening around, you can go ahead and type help, the / help, and one of the moderators will come down to assist you.
Ah, I see. Okay, that's cool.
Yeah, that's what I usually do. I usually, if let's just say, sometimes the PD department is busy, right? And it's a patient or someone being really chaotic downstairs or they're not listening. I'm dropping all my proper micros. I will then go ahead and drop help and explain what's going on, and put in the lobby, HP lobby, and then they'll zap right in.
Ah, I see. Okay, thank you.
Of course, of course. All right. Let's see. Okay. Number 4. Why is proper micro usage important during medical RP?
For number one, so direct communication, even if the microphone, let's say, it's not clear or anything, but it's also proof that that was administered.
Okay, good answer. Yes, as pretty much is micros keep RP structured, professional, and clear during medical scenes. So that's a great answer that you stated. All right. Question number 5. Where are green scrubs allowed to sell med kits and pills?
Only from behind the desk in the lobby.
Perfect. Great answer. Why is learning hospital structure important at this level?
Because this is the base and the foundation, so, and if you learn not everything, but if you learn a good base and fundamentals now, it's only going to help you progress to be super efficient and effective with the later ranks.
Great answer. Okay. Question number 7. What should you do if you see someone breaking hospital rules?
So this one, sometimes I get a little confused with. I know you're supposed to screen record it, but I'm still not exactly sure how to do that. So what I would do is just contact my supervisor, somebody there that's higher ranked than me.
Great answer. That's perfect. Actually, it's perfect. And then I'll go ahead and help you out when it comes to this the body cam screen recording. Depends on your device. We'll see what works best for you. Some people Twitch works great. Some YouTube by using their screen recorder on their device. So we'll see what works best for you.
Okay, perfect.
But yeah, follow the chain of command. But yeah, just report it to leadership or higher up. If there's something going on downstairs and you see someone breaking the rules, yeah, report to one of them. Body cam will be great if you can have it as proof too as well. Okay. All right. What skills have you learned that prepares you for white scrubs?
Definitely the trainings, especially the MD one, and also the CPR trainings. Even though I completed it once, I did it a few times. Just practice makes perfect, and that honestly helped me progress a little bit because it taught me how to do it and also how to use the macros with it.
Great answer. Okay. When must you when must your body cam be turned on?
before you start?
Great answer. Yes. At all times while on duty, especially before responding to CPR calls.
So I have a follow-up question, if that's okay, on the body cam.
Yes.
So I noticed people have the macro for it. I don't. I don't know if that comes with the next scrub, next phase. But do you physically have to get it somewhere in the hospital, or you just hit that macro and then it's like automatic?
Did you pass your micro test, correct? You completed that, right?
Yes.
Okay, so I'll show you which one you will drop, okay?
Okay.
Do you have that one?
I do not.
Oh, really? Okay, so I need for you to have that one in your micro, so that way you can drop that prior to going out on CPR runs, as well as if a situation happens.
I see. Okay.
But you have all the other ones, right? Like the CPR, all the flobby ones, and everything of that sort. Well, you do because you asked for permission.
Yeah, I have pretty much the other ones too. The only one I don't have is this body cam one.
Oh, okay, cool. Yeah, just put whenever you have time, put that one in, okay?
Okay, no problem. And it doesn't matter which order, like if it's all the way at the bottom or.
Yeah, it's going to automatically go at the bottom. We don't have an option of like rearranging them in the order that we want. The only way that you'll be able to do that is if you delete them and re-enter them the way that you would like to have them in order.
Got you. Yeah, I tried to mess around with it once, and then I started deleting some, so I had to redo it.
Yeah. So yeah, that's what I'm saying. You can just keep it. Just make sure. The main thing is to drop it. In chat when you're about to turn it on. But a lot of times they're not going to be in order because then you add new ones, and then you have to go ahead and delete and just reorganize them to the way that you like it. But I would say do that if you want to, when you have time and things of that nature.
Okay, I will. And to add it in, is it just / and then the message, or is it like a floppy? I mean, floppy is the blue, but
Yeah. It's going to be, I believe it's due. Let me see. Hold on one second. Yeah, it's going to be / do, and then of course space, body cam, recording activity. So yeah, it's going to turn pink. So it'll be / do, and then that message.
okay, perfect. I'll add that in right now.
All right, awesome. Okay, what happens if a medic uses a firearm while in the medical faction?
The person using the firearm will be fired or dismissed.
Correct answer. Yes, and that is the MD5 rule. Okay, so number 11. What is the maximum pill limit per patient?
6, and if they request more, then we have to tell them to book an appointment.
Great answer. When are you allowed to refuse medical treatment?
When there's a serious threat.
Well, sometimes they will probably threaten you verbally, but the time that you can refuse medical treatment is if they're holding out their gun, their weapon. If they have a weapon in their hand, then don't give them a med kit or pills.
I got you. Yeah, that's pretty much what I meant. Threat, like
Oh yeah,
towards the EMS.
all right. If you can do me a favor, can you demonstrate how to teach a green scrub how to do CPR? A CPR. If you can,
Sure.
also drop the proper micros for it.
Sure. So first you approach the body, then you get your CPR med kit out. You put it on the body first. As you put it on, your body will spin like this. Once you put it on, you have to make sure you use it first, then add these macros. Once complete and the patient has been revived, then you would give them a med kit and administer this macro.
Amazing. Great job. Great job. Quick question. Which one is the emergency kit? Which color?
Emergency is red, med kit is white.
Awesome. Oh my gosh. Great job. You did really great. You did really good. All right.
Yeah, the only thing I'm not too good with still is the like knowing the exact numbers of the rules, but I always have my iPad out with the exact numbers. So I was a little nervous to do this today because I'm not home. I'm actually on vacation, so I didn't have my iPad out to just double check everything quick. But yeah, thank you.
Oh well, for you did amazing. Okay, you did amazing. And when it comes to the MD rules and our policies and things of that nature, our project rules, that comes with time to understand them all, to remember them. All that does come with time. So don't like beat yourself up if you don't know them all by heart right at this moment. It does come with time. And then of course we're going to see scenarios that happens in real time. That's going to have you okay. This is what this micro is for. So forth, so forth.
Gotcha.
All right. Well, Adam, great job on your very first interview with EMS. I do want to go over what you'll be responsible for as a white scrub. You'll need to complete your first CPR field training with a field training director before riding with blue scrubs or higher. Attempt CPR calls on 3 separate days each week. Finish 35 total CPR attempts. Respond only when a blue scrub or above is present after clearance. And submit CPR logs with body cam footage. You will also complete taser training and safe driving training in the hospital. You must follow all MD and HP rules, sell medkits and pills only in the hospital, and keep your logs organized. For pharmacy, you will learn the full structure, completing a 30 vitamin appointment, logging correctly, knowing pill limits and policies, understanding regular and VIP appointments, pill dash, and PD army drops, having your micros ready, and passing a 15 pharmacy quiz. Once all requirements are done, you'll book your next interview through Setmore. Do you have any questions for me, Adam?
No. Will there be a new checklist sent to me?
Of course. Right when we're finished here, I'm going to go ahead and send over here the new welcome packet for you, as well as the checklist.
Perfect. Thank you so much.
Of course, and you did really great. I will tell you, you were really great. You did a good interview.
Appreciate it. Thank you.
Of course. So you're all done here, Adam. If you like, you can go ahead and go back downstairs to resume your activities like passing out med kits or pills behind the desk or doing your med delivery runs. And I'm going to send over the checklist and upload your interview video for the DCPs to review. And I know that you're on vacay as well, so if you have to clock out and stuff like that, that's also understandable. But I will definitely keep you up to date in Discord.
Okay, perfect. And so when is the white scrub transition?
So today it's 24/7. I mean, not 24/7. I'm so sorry. 24 hours. So it's from 12 a.m. EST to 11:59 p.m. EST.
Okay, copy that.
Hopefully everything goes well and gets done for you today. Usually breakups, I believe it gets done today. If not, I believe it'll be next Tuesday, which is the breakups for ranks 0 to 4. but I'll definitely let you know in Discord.
Okay, perfect. And is this something I have to show up for, or is it just automatic next time once they approve or whatever, I load into the game and then it switches?
Exactly, yes. Once it's approved, if I believe if your interview is done today, possibly then you'll get rank up next rank, which will be next Tuesday, and it'll be automatically done. So when you log in on Tuesday, you'll see your color of white. But again, I'll go ahead and check with Dr. Addison as well as Dr. Kennedy to see, even though you completed your interview today, will he get rank up as well today, or will he wait till next rank up? I'll check for you.
Perfect. I appreciate that.
Of course, of course. So, yeah, again, you're all set here, and I'm gonna go ahead right now. I'm gonna send you over your new welcome packet as well as your checklist.
Perfect. Thank you.
Of course. Okay, I'll go ahead and get the door for you.
Follow the chain of command. So what that means is you need to